welcome, and thank you for joining us today. Thank you. Can we unmute ourselves and just say hi? Let's hear ourselves, say hello to ourselves. And if you can put on your video, please do that as well. And let's just see all our beautiful and handsome faces and just say hello to every one of us. And thank you all from myself to all of you here. I'll introduce myself after. But let's hear some beautiful voices and see some beautiful faces. Hello, 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 everyone.
Hello.
Please unmute yourselves and say hi.
Hello, Adiola. Good evening. This is Mrs. Abang.
Good evening, Mrs. Abang. How are you this evening?
I'm fine, and you?
Very well, thank you, ma'am. Thank you for joining us today. Thank you so much for joining us. I'm sure we're looking forward to a fantastic time. I'm already excited. I'm sure you can see it in my body.
I see it. I see it.
I'm already excited. I'm very excited. Thank you very much for joining us today. Who else is there? Who is ready to say hi as well so we can see your beautiful faces and hear?
Hello, good evening.
Who else is sharing? Good evening.
Good evening. This is
Good evening, Mrs.
Good
Olare.
evening.
How are you?
I'm fine, thank you.
Nice to meet you. Nice to meet you. And you have a beautiful smile, and I like your pink and yellow. It's pink, right? Thank you very much for joining us today. Thank you so much.
Thank you.
Thank you so much for joining us. I can't wait to start questioning you, but let's get people, in the house first, and then we'll kick it. We'll kick off with you. Thank you very much for joining. Who else is there ready to say hi with their beautiful faces and beautiful? Just unmute yourselves and say hi, please. Hello, hello, hello. Just unmute yourselves and say hi.
Hello.
Hi.
Hello. Hi, this is Adele.
Good evening.
Hi, good evening.
How are you today?
Very well, thank you. And you?
Very well, thank you as well. Okay. Good evening, good evening, good evening. Thank you for joining us, Mrs. Ebele Chuku. Thank you very much for joining us today.
Thank you for having me too.
Thank you very much. So I think we're gonna dive into today's seminar conference connection. Today it's going to be a phenomenal time. My name is Adiola, Adiola Kingsley James, and I'm moderating, and I'm really, really excited to have this opportunity to share with professionals and beautiful people who give people hope. And I hope out there that we have other people who are also going to share, ask questions. We want it to be educative, yes, but also very interactive as well. So what I ask is that there's a question and answer box where you can send in your questions and we can pick them and answer them, and so that it's clear. Let's not confuse it with the chat box, because the chat box will just be like a general chat box. So if we send our questions to the question and answer space, we're able to pick out the questions and ask the professionals, and we're able to see clearly. It's also, like I said, going to be very educative, but also very entertaining and also very transformative, as I will say, because we have people here who are going to share all kinds of nuggets with us. They're going to share their experiences with us. Later today, also, we have a dear friend called Larry, who's going to share her own IVF story and give hope to people. So you don't want to go anywhere, because she's going to come much later in the session and share her experiences. If I would ask one question, and I would ask that you put it in the chat box. If there's one thing you would have picked up from so let me rephrase that. How can we serve you today, whereby at the end of today you would say to yourself, I'm so excited that I was part of this webinar and I learned one thing at least. Send us a chat so that we can pick from there and do exactly what we're meant to do, which is to give you one nugget at least that you can go home with and say, yes, I attended that webinar and it was completely worth it. So without much ado, I'm going to call Mr. Praise Fowowe, who is a dear brother and friend of mine, to kick off the session, and then we can start off. Mr. PF, are you there?
Yes, I'm here, Adiola.
Please, let's start off the session. And I'm honored to have been called by you. Thank you.
Okay, thank you, everyone. We're really, really excited to have you in with us today. I mean, this was a session that started from a discussion. We were having a show, a Thursday show, and we had invited Larry. And I mean, we learned a whole lot about IVF that we never thought about. I'd seen a movie, I'd heard about IVF. I mean, I've always been bothered about, you know, why is it that when they say people are waiting for the fruit of the womb in Nigeria, it's only women who show up. When they say people should come for prayers in church, women are the ones they expect to come forward. And I keep wondering, are the women the only ones with fertility issues? Then I was invited to come and speak somewhere 3 years ago. And the person before me was sharing the testimony of how for 18 years, she was waiting for the fruit of the womb. That's how we say it in Nigeria. And that God just did it once, and God gave her triplets at the same time. You know, and she went on and on and on. Then she asked people who wanted to have the same miracle to come forward. And I saw over 150 women. Honestly, I did not know fertility was a major issue until that day. 150 women, and she prayed for them and asked them to go trust God with their husband, and that God was going to do a miracle. There was no man who came forward. So I kept sitting I kept thinking where I sat, that does that mean that men are not sterile, or what exactly is this issue? Why is it a women issue? But the second question on my mind was, she waited for 18 years, then God responded with triplets. Was that just a miracle, or there was more to it? I was the next speaker after her. So as she came down, I whispered to her, I said, Madam, congratulations, but I would like to know, did you attempt IVF at any point in time? Then she said, yes. But that, you know, God is the one that will still make it work. And so I asked, why didn't you say it there? So I had a choice to make, either to pretend as if it was just God that did it. I mean, God is the one that does everything anyway. Or I should educate the people further. So I grabbed the mic and I asked all the women who came forward to stand up again, and they stood up. And I said to them, I said, well, I'm not supposed to speak on fertility, but I think after now, the first thing I need you to do is to go check out yourself and your husband to be sure that you guys are okay. Number two, there is a process called IVF. Can you start that treatment? And let's just trust God and see what would happen. Of course, I knew that was the last time I was going to be invited on that platform, you know, but it didn't bother me, because I wanted something that could help women. And I felt every time I went to church and I had God did a triplet, twins, I just knew there was an element of IVF. So why don't we testify about IVF? Are we believing that IVF is not, children from IVF are not proper children? Are we thinking is the devil giving these children? Why don't we talk about surrogacy? Why don't we talk about other options, adoption and all? Why do people who adopt children can't even come and do child dedication? You know, these were things that bothered my mind. And that day when we had the show, we felt, okay, let's start having this discussion at the level of the Institute of Family Engineering and Development, since that's all we do is about family. And I'll make you laugh. When the first flyer came out, it was a woman who was pregnant that was on the flyer. And I looked at it and I said, no, we can't even join the stereotyping. If we're looking at, and the topic was women and fertility. And I said, it can't be women and fertility, it must be couple and their fertility. Go and look for a proper picture that depicted a couple, because it takes two to get pregnant, you know, and that was why we changed it. So I want to believe that today we're going to be helping a lot of people, and we're going to be able to talk about IVF as if we're talking about getting a cure for headache or something like that, that there are several processes that God can use to answer people's prayers. And IVF is one of them. The first person who was inseminated was Mary, the mother of Jesus, you know, and we'll talk about that with pride, or maybe she was also the first surrogate mother or something like that. You know, we talk about it with pride, but people are ashamed to talk about this. I think Africa needs to move away from all this stereotyping. We still struggle to, some people still believe that women who go through CS, and they have less faith than people who do natural birth. And several women are still dying of natural birth in Africa. We need to begin to have this conversation and begin to educate people to say there is nothing wrong with you. And I'm hoping that at the end of this discussion, we'll begin to look for cheaper ways to help people. Maybe the adoption process will become simpler. Thank God we have people from the representative of Lagos State government here so that we know exactly how it works. Maybe surrogacy becomes something that we are all comfortable with and God can use it to answer our prayers. Or maybe it's going to be IVF, you know, whichever way. I know IVF is a bit expensive, but we have to find a way to help more people. I believe everyone can smile. Everyone who has been married, who wants out, can actually have their children. And I hope that all our facilitators will do justice to this process. And at the end of the answers, please feel free to ask your questions in the chat box. Our moderator, will ensure that our facilitators answer all those questions. On behalf of the Institute of Family Engineering and Development and the Center for Sex Education and Family Life, I want to welcome you to this discussion. We're going to hit the bull's eye. We're going to say the way it is, and we hope that at the end of the session, we'll all become very comfortable to understand that there are several processes and we can actually go through all these processes for God to answer our prayer. At the end of the day, He's still the one who answers all the prayers. Thank you very much, all our facilitators who have obliged us to come and share from the well of experience. We're really, really grateful from the Institute of Family Engineering and Development. God bless you. I mean, we believe that posterity will remember you for good as being some of the people who made our couples smile. And if you are here because you want to go on this process, we believe you have answers. And we believe that we will see you smile. You will share your testimony as well. Everything we need to do to assist, we will make sure that we do that. Thank you very much. Let me welcome you officially and we declare this function open. Thank you, Deola. You can take it away.
Thank you, PF. Thank you. I remember the conversation, yes, because we were on the show together. And we had some enlightening conversations. And I think with me, my mouth was agape most of the time because I was hearing things that I hadn't heard in a long time or never even heard, and so I really appreciate the fact that these conversations have started. And like you said, praise, I hope that it gets to a point where we get very comfortable with talking about these things and not feeling like outcasts because we just adopted a child or we had a surrogate mother, birth a child for us, or we had to go through IVF. Like you said, people would just say, oh, praise the Lord, I was waiting and I had a child, but nobody actually shared. Not many people share the process. And we need to start to talk about it as if it's a normal thing. And so with that, I first of all want to thank our partners, Life Starts Foundation and Fertility Nurses Association of Nigeria. Thank you for partnering with us on this seminar. We really look forward to having more of these kind of conversations as we go ahead. But thank you very much. I just need to put that in before we dig in. Mrs. Olaore, I hope you're still there. Can you unmute yourself and put on your camera? I'd like to start with you first.
Okay.
If you are there. Yes. So let me first of all introduce you. Mrs. Olaore, Mrs. Agnes Seishayo Olaore is the Assistant Director, Lagos State Ministry of Youth and Social Development. She's also the head of Adoption and Fostering Unit in Lagos State. Thank you very much for being here today, Mrs. Olaore. It's a pleasure to have you. So let's just, go right into it. And let me ask this question just for asking sake. What is adoption?
Okay. Adoption is a process whereby suitable persons through legal means assume parental rights over certain categories of children, because not all children can be adopted. We have certain categories of children that can be adopted, and it has to be through legal means. And those prospective adopters must be suitable. We do a lot of assessments. We scrutinize them to find them suitable. So it is only those that are found suitable that can assume parental claim over certain categories of children. And the categories of children we are talking about are abandoned children, children that have been abused, children that have been neglected, orphans, those are the kind of the categories of children that can be given up for adoption.
Fantastic. So I'm going to then ask another question, which is, how is that another option to being a parent?
Yes, we have different options of being fruitful in life. Adoption is one of those options. We have, you can be fruitful, you can have your own children through, the natural birth. Mm-hmm. You can have your own children through surrogacy. You can also have your children through, IVF, as it has been explained. And adoption is one of the means, is another option through which you can be fulfilled as parents, that you can actually enjoy, being fulfilled as parents. It is done through legal means. And when we talk about legal means, we have so many stakeholders involved. We have the police involved, we have the judiciary involved, we have the social workers involved. And this, the adoption process has been established by the law of the land, which we call the Child Rights Law of Lagos State. It has been established through legal means, and it can't be revoked except, there is a case of abuse. That is the only instance that adoption order can be revoked. So it is a very good option for parents or for, prospective, adopters to also enjoy, the joy of parenthood or the joy of being fruitful.
Fantastic.
Thank you.
I asked that question so that people can hear that is another option. Like you said, it's another option of being a parent, because they're different options. So now, and I've heard different people mention that it is hard to adopt children in Nigeria. Sometimes it takes over a year. People have to wait, even after meeting all the conditions. It still takes a long time. Why is that so?
Well, most people want to have it so quick, just like that. But since the adoption process has been established by law, we have to do everything according to, the laid down rules. And in the Child Rights Law, it has been stipulated that at least it will take 12 months. At least it will take 12 months before an adoption order can be given. But most people want to, write the application letter today, get their approval tomorrow, and maybe in a week's time get a child. But it doesn't work that way. It doesn't work that way. If maybe later I will take you through the process of adoption in Lagos State, because it is a process. Yes. We have to follow the due diligence in getting an adoption order. It is not just adoption is not a process that will take you just a month. No, it will go according to the laid down rules, which says it must at least take 12 calendar months. That's what the present law says. Even though we are going through a review presently, it may be shortened at the end of the day, but presently it will take at least 12 months.
Is it possible to share with us what happens within this 12 months? So like you said, the process that happens at least in Lagos State. Can you share that with us, ma'am?
Yes. The first stage in the process of adoption in Lagos State is to write an application letter to the Permanent Secretary, Ministry of Youth and Social Development. When we receive your application letter, we sort the applications and we give the applicants a call or invite them to come to the office. Then we take them through what we call a mandatory pre-adoption counseling. That is very key. because we want to know who actually wrote the application. We want to meet the husband and wife. If they are couple, singles also have the opportunity to also adopt. That's also in the law. A single woman, a single man can adopt. So in the case of couple, we like to meet the two of them, because sometimes we find only women coming and we ask, we want to meet your husband. So during the pre-adoption counseling, we get to meet the couple, we get to meet the applicants, and we take them through a period of counseling whereby we invite, we invite facilitators to take them through what adoption process is all about in Lagos State. We have our legal officers in charge of, they are representative from the Ministry of Justice. They are with us in the ministry. They take them through the legal implications of adoption in Lagos State. We also have a medical doctor that we also let them know some medical challenges that some children can have. We also have our directors from the ministry that we let them know the kind of processes they have to go through, obtaining medical result, going to the general hospital to obtain their medical, going through medical tests at the general hospital, so that we can know that they are fit, not just physically, but also emotionally fit. So we don't just use any general hospital. We make use of those general hospitals that have psychiatry session where their emotional aspects can also be tested. So all those things have been put in place after the pre-adoption, pre-counseling. Then we take them through submitting their documents. We do documentations. We have so many documents we have to collect from them: their birth certificates, marriage certificates, evidence of tax payment in Lagos State, evidence of a proof of employment, and all other documents like that. After the documentation, then we do what we call home assessment. We want to visit where they live. We want to know that they live in Lagos State, that they are residents of Lagos State. So we actually go to their homes. We take pictures. We want to see that their homes are suitable, for child upbringing. And we take pictures as evidence of doing their home assessment. All these are documented. We have all these put in their files. So if their home assessment is satisfactory to us, then we move to the next stage, which is the stage of making payments. They make payments of 80,000 naira as administrative fee into the Lagos State, account. So after that, we take them through the panel interview. The panel interview is actually not the last stage, but this a stage before they get their approval. They sit before the stakeholders, in the process of adoption. They are asked questions. They take them through interviews. If they still need to cancel them, they also cancel them. And we have the Honorable Commissioner of the Ministry of Youth and Social Development as the chairman of that panel. We have a permanent secretary. We have chief magistrate from the family courts in Lagos State. And we also have the officers in charge of the juvenile welfare centers, which is being manned by the police. We have two JWC in Lagos State, the one at Adeniji Adele. We have another one at Alakara. They will all be present to ask questions. If they are found suitable, then we will now issue them what we call approval letter for adoption in Lagos State. When we give them the approval letter for adoption in Lagos State, we also give them the list of registered orphanages where they can go to source for children. In Lagos State, we have over 50 registered orphanages.
Wow.
And those are the only ones, those are the only orphanages we expect prospective adopters to visit to make choice of children. And we normally tell them when they get to the orphanage, they may see many children there. Not all the children in orphanages are adoptable. It is only those that have been abandoned and have been cleared by the family court that can only be given up for adoption. So one of the main challenges that we have in the process of adoption, why many people think that it takes a very long time, is that the number of applicants that we have for adoption, there are so many.
Wow.
There are so many, and that I can't start to give the percentage now to the number of children that are available for adoption. And because of the advocacy that we do, the number of children that are abandoned it has reduced drastically. So not many people abandon children nowadays because we do a lot of advocacy. So after, giving them the list of the registered orphanages, they go to the orphanages, they visit them, they submit their letters to let them know that they are interested in adopting a child. Yeah. By the time they make a choice of a child in those orphanages, then the orphanages inform us of the decision that a particular couple had made. Then the court may even ask them to come, that they want to know. The chief magistrate in the family courts where the case of that child has been registered may ask the couple to come, that they want to know them before the child is released to them. They may ask them questions, and after going through their approval letter, a child is now released to that particular couple. And from our own hand, in our office, we also do what we call official release. We take pictures, and that is put in the file. Thereafter, when the child is released on probation period between 1 month and 3 months. We call it probation period so that we'll be able to assess whether the children, we do well with our family. Then we do what we call bonding assessment. We visit the family to actually see, how they are taking care of the child. We ask questions. If we need to counsel them in any area, in parenting and all that, we do all that. If the child has any medical challenge, within that probationary period, within that bonding period, they'll get to know. So if during the bonding assessment, if we are satisfied with the bonding, assessment, then we proceed to the last stage of the adoption process, which is called legalization. Legalization is done in the family court, not in the open court, but in the chamber of the chief magistrate. Everything regarding a child in Lagos State is done privately in the chamber of the magistrate. So it is at the point of legalization that the adoption order is given. And that is when couples or single, as it may be, are pronounced as the legal parents of that particular child.
Wow.
Thank you.
It sounds like a lot of work. I mean, because we're on the other side, we don't know this process. And so people just keep really saying that it takes a really long time. And like you've said, there are not as many children that are abandoned. I didn't even know that it was only abandoned children that can be adopted.
Yes.
So I thought it was children, in a foster home, for example, who can be adopted. Why does it have to go through the children's court for them to be adoptable?
For any abandoned child to live in any orphanage, there is a legal document that is called care order that is given at the family court. No child will be admitted into any orphanage without that legal document called care order, which is obtained at any family court in Lagos State. And for that, you know, for any child, for any of such child to be released for adoption, that care order must also be discharged at the point of release.
Interesting, interesting.
So
Very enlightening.
But then let me also add too that we also have a type of adoption called relative adoption. For relative adoption, it doesn't really take much time because there is a child available, a family member, maybe a family member whose parents have passed on, a family member whose parents, you know, do not really have the means of taking care of them. You know, they can come to the office, they can actually write an application that they want to take up the responsibility of such children who are orphans or whose parents cannot take care of them. They also go through that process too. We also go to court to get, you know, an adoption order. And at that point, the name of such a child will change to the name, you know, of the family taking them up. So that, you know, there's a child available from a family, unlike, you know, the child that will be gotten from the orphanage.
Oh, yes.
So that is also another type of adoption.
So I've got two questions, and we're going to talk about the different kinds of adoption after the questions. Can someone residing in Osun State adopt a child in Lagos State is one of the questions.
No, ma.
Why so?
No, well, it is in the law. Just like I've said that everything we do, you know, has been stipulated in the child's rights law. And in the child's rights law, one of the things you have to do to adopt in Lagos State is that you must be resident in Lagos State. Wow. You must be resident, because we will definitely visit your home. We want to know where you live. We can't go out of our jurisdiction. We can't go to Osun State, you know, to assess, you know, a family that lives in Osun State. So we can only assess those that live in Lagos State.
And the people in Osun State then will assess the people in Osun State, I want to believe.
Yes, you know, every state has its own adoption process.
Okay. So another question, is it possible, I mean, it's kind of would answer this other person, but I'll ask it anyways. Does a single lady in who lives in diaspora, can she adopt a child here in Nigeria? If this single lady lives abroad.
We have what we call international adoption. Yes.
So please,
that is international adoption.
What's the process for that, please?
Well, we have about 3-4 adoption agencies, international agencies, registered with Lagos State government. So we have, for example, we have a particular agency that has been registered with the Lagos State government, you know, to take up adoption for those that live in Canada and in US. We also have another adoption agency, you know, that takes up the adoption process for those that live in France, Italy, you know, and some other European countries. So they have been registered with us. So when we receive such application, we call the applicants to get in touch with those agencies that we now link them up. And we link them up with an adoption agency that we do what we call home assessment, home study in the particular country where they reside. So it is still the same process. It's just that we go through an international adoption agency, you know, to do the home study, to do the counseling, to do interview and all that. And all those, you know, all those interviews, every documentation and all that will still be submitted to our office, and we still go through them, we still scrutinize them at the end of the day before we issue approval letter for international adoption.
Okay, so for me, Ojeshino and Ige Abosede, I hope we're able to answer your questions. And I've got one last question. What are the factors considered before a child can be cleared to be adopted? And why do we have some children that are not adoptable?
Okay, for a child, for an abandoned child to be cleared, for adoption, we have a unit called the Family Social Services. They do investigation. They will investigate, the story of the child. At the point where a child is picked up, such a child will be taken to a juvenile welfare center, either Alakara or Adeniji Adele, or a police station that is very close to where such a child is found. And then a document is obtained, which is called police extracts. So it is the police extract that is made available to us. Through the police extract, we are able to know the story of such a child. And the Family Social Services, we go ahead to investigate. And they will submit their investigation report to the family court, where the case of such a child has been, filed. So the chief magistrate, reading through the reports of the investigation, we now decide. Well, it has to also it is also the social worker that we also recommend, that we give a recommendation if whether the child should be cleared or the child should not be cleared. Sometimes the magistrate may even say, let's wait a bit. Let's wait for another 3 months if anybody will come up, to claim the child. Sometimes they may say, okay, still visit the scene of the incident where the child was found and still submit another investigation report, until we submit a conclusive investigation report, such a child may not be cleared. So it is when the magistrate is satisfied with the report of our investigation that such a child is now cleared for adoption.
Fantastic. So I hope, anonymous attendee, I hope that answered your question. I have one other question that, and it's in a situation where the parents that adopted the child had to relocate to another state due to circumstances beyond them, few months after the adoption, would it affect the adoption? Is a question.
Well, if after the child is released to a family and legalization has not been done, they need to inform us. They need to inform us that they are relocating outside Lagos State to another state in Nigeria. But before, after legalization has been done, they can move to any part of Nigeria. It is only when they are moving outside the country that they need to inform us. Yes, okay. Because sometimes they may even need us to do letter to the embassies. They may need us to do letter to, to the passport office and all that. And we gladly do that to let them know that they have done the due diligence. They've gone through the process of adoption before getting that child. And another thing, after the legalization of the adoption process, there is the adoption order that is gotten, the certified true copy of the adoption order will be taken to the National Population Commission. At the National Population Commission, we have a register for adopted children there. So with the certified true copy of the adoption order, the adoption will be registered. And the birth certificate will be issued to the parents, which will now bear the name of the parents. So with that child is legally theirs, and no one can withdraw such a child from them anymore. Thank you.
Fantastic. Thank you very much. My last question to you before I release you, Ma, is you mentioned if you go to their place, you release the child, then you check their bonding and see if they're compatible, and then you then get the legal documents to finally let the child go. Is there a process after that to check on the children and make sure that the children are not being molested or used for child labor or being maltreated? Is there a process after the legal documents have been given to just make sure that they're fine? And then, if possible, take them back if needed.
Yes. we have a unit in the ministry called the aftercare unit. The aftercare unit supervises, all adopted children in Lagos State until they are 18 years old. And that is part of the order that is given during the legalization, that any adopted child will be supervised by the ministry until they are 18 years old. So we go on periodic, or occasional, visits, and we also expect the family to submit, periodic reports to us, progress reports about the child, maybe every 2 years, every 3 years, we check on them. Then when they change their address, they are to notify us so that we can know the new address where they live, and we can still check on the child.
Thank you very much, ma'am. Thank you so much for your time. I hope you're still around because there's a couple of other questions, but if you check through the question and answer box, maybe you can also answer it directly, so that we're not keeping you tied down again. Thank you very much for being a part of us, and well done. Well done. You guys are doing a great job. We're going to bring you back because we're going to have these conversations again, and there are many more questions people have to ask about adoption. And I mean, who else to answer it but you, if you get what I mean? So thank you very much about sharing the practical steps and allaying our fears that it's not, everybody is being, doing their due diligence. So it doesn't take forever to adopt a child. It's just that different processes need to be put in place to make sure that the child is safe, and also the parents are safe as well. So well done for the work that you do, ma'am.
Thank you.
Thank you. So Mr. Leke Daramola, you're going to be going on next. I can see you in the picture. I can see your picture in the box, and we're ready for you. Mr. Leke Daramola is a clinical director at Embryo Fertility Center, Lagos. He has 7 years in treating all forms of infertility cases through consultation, counseling, assisted reproductive technology. He's a member of American Society of Reproductive Medicine. He's a member of European Society of Reproduction and Embryology, and also a member of Association of the Reproductive and Fertility Health. All tongue twisting, but I was able to go through it. Thank you, Mr. Daramola, for being here. Please unmute yourself so that we can have a wonderful time together.
Yeah, thank you very much. Good evening.
Good evening.
Thank you for inviting me for this program. I really appreciate that. So I would thanks. I would also want to know, should I just start by a little brief education on IVF?
Yes, because that was the first question. What is IVF?
Okay, good. So, all right. IVF, it's an acronym for in vitro fertilization. In vitro fertilization. Fertilization means when the sperm and the sperm from the man meets the egg from the woman, and they meet together, and it's been converted to form a baby. But in medicine, we call it an embryo. So fertilization occurs inside the woman's fallopian tubes. That's during ovulation, and she has sexual intercourse. But once we try to achieve fertilization outside the woman's body, we say it's in vitro fertilization. So its short form is IVF. IVF was founded by a physiologist, Dr. Robert Edwards, in 1978. He had this inspiration that if people face infertility every time, and he realized that the reason why they can't get pregnant is because the sperm and the egg do not meet. And there are 3 to 4 reasons why the sperm and eggs don't meet. It's only in our part of our country whereby we feel everything could be spiritual. But actually, the truth is, the truth is, once we face challenges getting pregnant, it's because the sperm and eggs do not meet. And the causes behind this are, number one, the sperm is not enough to get into the woman's body to ensure fertilization. That's in a case of a low sperm count. Another scenario is the sperm gets into the woman's body, but there's no egg that has been ovulated. So we call that one an ovulation problem. And there are several causes of that. Thirdly, the sperm gets inside the woman's body. The woman also releases her eggs to the fallopian tubes. But there's a blockage whereby the two parties can't meet. We call that one blocked tubes. So when this happens, we normally define infertility as the inability of a couple to conceive after 1 year of frequent, unprotected sexual intercourse. So it's medically said that way because we feel that if both parties should engage in intercourse for a year and there is no pregnancy, then we now say, okay, let's do some tests. So, and I would like to chip in this. For every month, it takes a couple who are normal in terms of their fertility. They have a 30% chance of getting pregnant every month. So it's not as if once they are both normal, they must get pregnant immediately. They only have a 30% chance of getting pregnant. So when we realize this, IVF comes into play. But before I even go deep into IVF, it's important to know that it's not everyone that needs IVF. As I said earlier, after 1 year, and there's a challenge, it's best for a couple to see a doctor where they'll perform a test. Normally, when I say a couple that come to me after just 6 months of marriage or 6 months of trying, we still tell them to try for 1 year. So after a year, they go for tests. They check the sperm, they check the eggs, the hormonal assay, they check the fallopian tubes. So the only reason why a couple would go for IVF, I'll list them out. Number one is if the sperm is so low. There are different categories to low sperm counts. We have the mild, the moderate, and the severe low sperm counts. So if the sperm count is moderate to severe, it's an indication to doing IVF. Other reasons are when the woman has some ovulation problems. One of the commonest cause of ovulation problem is what they call PCOS. It's called polycystic ovarian syndrome. It's another story for another day, but it's a common cause of ovulation problem. Also, another one is called endometriosis. So when a woman is diagnosed of this and they've tried all means, IVF is indicated. Other reasons why IVF is indicated is when the woman has a blocked tube. When the tubes are blocked, the sperm can't pass through the tubes to meet the egg. And some will say, go and do flushing, go and do massage. Well, all these are not guaranteed to work, to clear out the tubes. So IVF could be the best option. And I think in summary, if one has tried, because I'm saying this because we need to get enlightened. If a couple has tried 4 to 5 years of trying, it's best they go for IVF because any cause of infertility that has lasted for more than 3 to 4 years, it's best they go to get advice on doing IVF because before you know it, it's 10 years, it's 15 years, it's 20 years. So those are the indications for IVF.
Okay, but what is the success rate of IVF itself?
Okay, good. It's a good question. Well, it's relative because there are different causes of infertility. But in generally worldwide, the success rate of IVF is actually between 30 to 40%.
Oh.
Even in the UK, they will say after doing it for 3 cycles, chances increase. They'll opt. Anybody wants to be able to opt to like plan for doing 3 cycles to increase their chances. But on a single cycle of IVF, it takes 30 to 40%. But that's just the old, looking at it at a old glance. As I said earlier, it's relative. For example, if the cause of infertility was blocked tubes, and the sperm is okay, the eggs are also of good quality, their chances are higher, like 60 to 70 to 80%. But if it's a case whereby the eggs are not of a good quality and the sperm is also not so good, then the chances are reduced. So it's a relative, the success rate of IVF is relative. But in summary, it's 40%, 45%.
Wow.
And yes, and people think that people also think that each center have their own success rate. But the mother asked me, "What's your success rate here?" What's your success rate? Well, there's no super clinic or there's no super hands like that. It's science, and science can never be perfect as God, So generally, it still stands at 40% success rate, even worldwide.
Can you take us through the process of IVF? So
okay.
I'm a client or a patient who comes to you. Take us through that process, please.
All right. Okay. So the way it works is this: we first of all we collect the patient. When the patient comes with a complaint, we try to understand what has been going wrong. Try to know the duration of infertility. Try to learn if they have been on fertility medications for a while. Then after getting a lot of information, their age, their last menstrual period, they have a regular cycle, and a lot of medical questions, gynecological questions, obstetric questions. When we get all those questions, we examine both couples. Like the man that spoke earlier, that is not only about the woman, it's both couples. Personally, for me, I do not see the woman alone. I would insist that they bring their husband. If they don't bring their husband, I don't see, because fertility is both parties. So we examine them, we examine the woman, check her blood pressure, we check for fasting blood sugar, we check her pulse rate, we examine her breast examination, abdominal examination, because sometimes the cause of infertility might just be a simple thing to just solve. It's not always IVF. For the man too, we examine him, do his blood pressure, check his pulse, check his chest. We also examine his scrotum. Maybe there's a problem with the scrotum, like varicocele, what do they call it, this testicular failure or the rest. So we examine them. After examination, we now do some screenings. Now we call these screenings the basic fertility screenings, which involve checking the sperm counts, checking the hormonal assay of the woman, checking what they call anti-Mullerian hormone. This hormone has been used to determine the ovarian reserve of women. And it's a very important test because most people feel that once they ovulate, they should get pregnant. No. It's only if you have quality eggs. Once you ovulate, quality eggs. So this test will let us know if a woman has quality eggs or not, whether there are enough eggs in her ovary. Other test we do is the HSG, the normal painful test that most women are scared of doing. That one checks for the tubes, whether they are patent or they are blocked. We also check, so these are the basic ones. So when that one is done, and we now find out that all tests is pointing towards IVF, we now have what they call a review, whereby we call the couples for a review and counsel them on the reason why they need to go for IVF. Now, IVF is a journey. I'll call it a journey. It's a process. It's not 1 + 1 = 2. It's not like treating malaria. This IVF is a journey. I normally tell patients that when you are traveling to Abuja and they tell you that when you get to Abuja you'll be given $10 million, but you have to walk. So since you know that in your mind, you know that there is this big money in Abuja, even though there's so much obstruction to getting there from Lagos, you just keep moving, you just keep actions. That's how IVF is. The baby is the goal. The IVF, the process is long. I believe those who have gone through IVF know what I'm trying to say. So now IVF, so we try to counsel them.
Trying not to say.
Yeah, exactly. So we need to let them know that it's a journey, it's a process. Now this is how it goes. Like once they have agreed to enroll for an IVF cycle, an IVF cycle involves, number one, ovarian stimulation, whereby we stimulate the ovaries to get a lot of follicles and extract the eggs out. Number 2 is when we collect the eggs. We call it oocyte retrieval. On the day of collection of the eggs is also the day the husband will produce sperm. Number 3 is embryo transfer. That is when the baby is transferred back into the woman, and that completes the IVF cycle. The IVF cycle works with the woman's normal menstrual cycle. Right. Now, there are two types of, two types of IVF cycle. We have the, we call it the own cycle, whereby the woman uses her own egg.
Right.
The other type of cycle we have is the recipient cycle, whereby the woman is not using no egg with her husband's sperm, but baby will be implanted into her. So there are two different cycles. So I'll just go with the common one, the own cycle. So when the woman sees her period, I'm not trying to make it short because it's so long. When the woman sees her period, she comes to the clinic for a scan. So we scan her to ensure there's no problem, no cysts, no infection, no fibroids. Then we now stimulate. Stimulation involves injections, a lot of injections. They take them for 9 to 11 days. During this period, they come for scans 2 or 3 times. These scans are to monitor the growth of their follicles. Follicles are sacs in the ovary that contain eggs. So they normally grow into a particular size. Now, while we scan them, by their 3rd scan, maybe towards the 11th day or the 10th day, the follicles are mature. We now inform them that we are going to collect this, we're going to suck out these follicles in 2 days' time. Please invite your husband will be invited for a test. To produce sperm. So when we extract, so when the day comes for extraction, we cancel them, we give them a mouth sedation, and we extract the eggs and the husband to produce the sperm. The sperm is being incubated with the egg into the incubator, and it is left there for 24 hours, whereby they both mix. After 24 hours, the babies are formed. We call them embryos. These embryos grow in the incubator for 5 days. The reason why we leave them in the embryo is to monitor their growth, their progress. That gives 5th day, commonly on the 5th day. Some women will say I should transfer all the 5 or 6, or we don't do that. The standard is for Nigeria for now, it's still 3. Once I'm below 40, we transfer 3 embryos into the mother's womb. So before transferring, we explain to the couple how it all went, how many eggs were collected, how many were fertilized, how many became embryos, how many are viable. We also grade them. Then we now do the transfer. And after the transfer, they wait for 2 weeks. The popular 2-week waits. That is not easy for any woman going through IVF. They're thinking of, is it positive, is it negative? I'm feeling, doctor, I'm feeling this sign. My breast is engorged, I'm feeling pain. That is not easy for women. It's not easy, So after 2 weeks, they come for the tests, and that's when we know what it turns out, whether it's positive or negative. So that's just the whole story of the IVF cycle. Let me just stop there. In case of any question.
Wow. It just sounds like without of course, yes, the end product is happiness, but it sounds like torture. Sounds like a lot of pain.
It's a journey. Yes,
yeah,
it is.
I like that journey, but it's not. Yes, that the end of it is this, but it's affecting your hormones, it's affecting your mind, your psychology, everything about you is
everything
affected.
is mixed up.
It's unfortunate. Well, I don't know whether to say it's unfortunate that it's the woman that really suffers it, and the man just comes and produces sperm and and that's it. But the woman has to go through all the injections and go through all the insemination and resemination, and it's a journey. It's not. And why is it that some people go 9, 10, 11 times and they still are not successful? Why is that? Why does that happen?
Well, there's something we call recurrence implantation failure. It means having 3 or more failed IVF cycles. The cause of this is, well, number one, it's unknown.
Yeah.
Other things are linked to it. Maybe if certain rare blood disorder, or maybe there's too much antibodies. Antibodies are like cells that try to attack foreign bodies in the body. If they are too much in the system, they could attack the embryos. Also, the womb might have what they call it has a low endometrial receptivity. There are many other unknown causes. Some will say chlamydia, some will say it could be an infection and the rest. But it's what I feel personally is once I see a patient who has done it once or twice that has failed, it's best to take caution, because personally it's not really good to repeat the same thing all over again. There must be a change in the system. I'll give an example. The indication for IVF is let's say a poor egg quality. We normally counsel patients that this is it. Once we get a poor egg that is not of good quality, it means it reflects on the embryo formed and therefore reduce the chance. So at the end of the day, if it fails and you come back to repeat the same thing, you have to repeat the same process and the same thing will happen. And the reason why this happens is that just to apologize, but some couple, like if they tell you that I'm just still young, why would I have a poor egg quality? I can't accept a donor egg, and they still insist on doing the same thing. But IVF doesn't know who is who. His own job is to form the baby, which it does, no matter how bad the sperm or how bad the egg is, to form an embryo. But the embryo, the quality now depends on the how good the sperm or the egg is. So as long as you repeat the same cycle, the same thing will happen again. To form an embryo, but there won't be conception. So I have couples whereby they would have done it 2, 3, 4 times with our own eggs. The ones that now change to a donor egg, they get pregnant immediately. So that's another kind of twist, another kind of scenario. Or sometimes the sperm is so bad that they keep trying using the same sperm all over, and it fails and fails and fails. When they now do what they call maybe Pcos. Pcos is it's called physiological intracytoplasmic sperm injection. It's a big grammar, but it involves whereby they try to select the best sperm cell to use, and voila, the woman gets pregnant, or donor sperm. So most time, the reason why there's always a recurrence in people doing 11 or 9 times is because maybe they don't change the formula. Lastly, another reason why we have recurrent failure is the womb. If the womb is damaged by maybe D&C, or a surgery was done to the womb that damaged the endometrium, the lining, it will be very difficult for implantation to occur. There's a story of one of my senior colleagues. He told me about this. He had a patient whereby they did it for 7 times using our womb. The sperm was okay, the egg was okay, but the womb was not so good. 7 failures. And when they now use the surrogates, they got pregnant. So that's why did I wait all this while? So sometimes it's about changing the process. So I don't really allow people to do IVF more than several times.
Can a woman die from this process?
Yes, although it's rare, but it's possible. It's very, very rare, but that's why it's important, because clients are carried away by the infertility and they forget about their health. Yeah. So that's why, if you remember, I mentioned that before we start any treatment, we do a proper checkup on them. Blood pressure, their sugar level, cholesterol level, breast examination, breast cancer, because sometimes these drugs can increase the risk to breast cancer for those who have maybe a positive history of breast cancer. So we do cervical examination to ensure that they are medically fit before we go ahead. That's number 1. Then also during pregnancy, there are tricks of having multiple pregnancies. And that's that makes their life also kind of threatened. So woman carrying 4 babies, fine. Well, it's a good thing though, but sometimes it could be a tragedy. You understand?
Yeah.
So that's why, like for example, in the UK, the number of embryos they put is 2. Above 40, 1 embryo. Here in Nigeria, the maximum we do is 3. There may be 2 for above 40. So before IVF and after IVF, I think the risk of mortality is actually higher during pregnancy from IVF. So,
Wow.
but we try to prevent that by reducing the number of embryos we transfer. Then during IVF process itself, we make sure that they are medically fit. If they are not, it's best to go for other means like surrogacy or whatsoever. But in Nigeria, the risk to death, yes, the risk to mortality is actually still low, very low.
Wow. And does weight affect it as well? Your weight,
yes,
being
both
obese,
sides. The weight, yes, both sides. Obesity and underweight, it affects fertility. Obesity in itself, yes, obesity in itself can cause hormonal imbalance because the woman in her body, she has a lot of cholesterol. They are broken down into estrogen. Estrogen is the female hormone, but too much estrogen in the body can shut down the ovarian function. So that's number 1. Then number 2, even if she starts to stimulate her ovaries, those drugs will even get into the bloodstreams for the ovaries to be stimulated. So at the end of the day, we have poor quality eggs. On the other side, say a woman who is underweight. So that's why we normally do that BMI too. I didn't mention that earlier. We do that body mass index to know whether they are obese or they are underweight. Women who are also underweight, that's below 18, they also have issues getting pregnant because the ovary depends on estrogen. So a woman who is underweight, she has a low level of fats, and therefore she has a low level of estrogens, and it can affect the quality of the eggs. So for somebody who is obese, we encourage that they go for a regimen whereby they lose weight. And funny enough, some get pregnant easily by just losing weight. Diet change, lifestyle change, and they get pregnant easily without any form of medication. It happens. And for those who are underweight, so we encourage that they take dietary supplements to improve their diet and such a healthy level.
So let's talk about the cost. Why is it so expensive? And I mean, in Nigeria, what is the range? And I asked that question because I know quite a number of people who have gone through it, and so I'm asking 2 questions. 1, what is the range for people locally and internationally, and why is it so expensive? And is there anything we're doing in the medical field to bring down the cost so that it's more affordable for people?
Okay. Well, IVF is expensive. Everybody knows that. In Nigeria, I think the range is between 3 million. I'll say that's the range. There are many reasons. There are many factors. We're in Nigeria, so obviously we import a lot of things. We import and import and import. So the currency, the exchange rates, everything affects the final price of IVF. Everything we use, from the drugs we use for the patients to the instruments we use to the consumables, to every single thing is always imported, and the prices change. That's one factor. The drugs actually is one that affects the final price, and the drugs actually play an important role in the outcome of IVF. There are several brands of drugs, and each of them have their own qualities. So most times most clinics go for the best drugs. So it affects the price. In other countries, like in the UK, in other countries like in the UK, in the US also, it's not expensive when you convert it. For example, a friend of mine that works in a clinic in the UK, I think they do theirs for is it 7,000 or 7,500 pounds or so. 7,500 pounds to 10,000 pounds or so. So converting that to naira is even looking more. So
yeah.
yeah, so it's actually expensive, and the instruments we use. And then for some couples whereby they need to do a lot of procedures, maybe in their own case requires ICSI, TESA, arching, PGD, the cost, donor egg, the cost
Higher,
just
higher.
yes, higher and higher. But what we do is what I do personally is to control the cost of drugs, whereby we try to understand the woman's physiology and stimulate her in a very moderate way, whereby we don't overuse drugs and we don't underuse drugs. And that has been helping too. Then we also try to give patients packages whereby they pay for 3 cycles at once at a discounted price.
Right.
Because the truth is this: the average couple will get pregnant after 3 cycles. There's no lie to it. It's the truth.
Wow.
Yes. The first cycle works for 30% of people. 2 cycles, maybe like 40 to 50%. Then those that do for 3 cycles, most people get pregnant after 3 cycles.
Okay.
You know, maybe they do one in this clinic, they do one in that clinic, then get pregnant in another clinic. So, but people feel that maybe because that clinic is kind of twisted, but on the average, it takes 3 cycles. So what we try to do is that we try to offer couples a package. Other couples do that too. So it's a discounted package whereby they can pay for 3 cycles at a go. So they have this opportunity to always repeat it and have that chance of getting pregnant within that package.
Cycles.
That's what we do for now. Yes,
so what
3
if
cycle package, 2 cycle package, another form of package.
How much is the 3 cycles?
Well, it depends on the clinic itself. It depends, but it's always discounted in the sense that when you multiply a cycle by 3 and you now compare it with what that package is, it's actually reduced by almost 25% or even more. It all depends on the kind of treatment. Yes.
And can that package, can you do it in other clinics, or it has to be in the same clinic?
No, yes, that's been the same clinic. Yes, that's been the same clinic.
So it must. So if I don't feel comfortable first time and I want to go somewhere else, then I have to go and pay somewhere else again for another cycle. I forfeit the other 2 cycles that I paid for.
Well, it depends on the policy, in that clinic. But most times, one that have gone through counseling to know what is it, and it depends. One can always go somewhere else, but it depends on what the policy is. But most times, after the first failure, there's always a review to know maybe there's a reason why it failed and what can we do different so that they
different
get
way.
Yes.
So are there HMO packages for this, or are do you have to just pay straight from pocket?
Well, it's for now, it's still straight from the pocket. I think some do screenings. I think some cover for the screenings only. That's the screenings, the tests, but most times it's not covered. The IVF fee is not, the treatment is not covered. Right? So for now.
My last question. Is it normal, or is it possible for for somebody who has had children before, maybe 1 child, 2 children, who want to have another child, and it takes them 3 years, 4 years, maybe even 5 years, and they think and they're not able to conceive another child? Is that possible? Does something, what goes wrong, and why does that happen? And then do you then need to do IVF at that point?
Okay, it's well, that is called we call it secondary infertility, whereby the woman has gotten pregnant before, but now she can't. The common causes of this is if a woman has done a surgery, or maybe D&C. Surgery, for example, CS. Most times we normally ask the woman that, how did you deliver your last child? If it's through CS, it's a possibility that the tubes are blocked during the process of removing the baby. Then, so once they're blocked, she can't get pregnant. Or maybe she had a miscarriage and it was evacuated and some remnants of the fetus stuck into to block the tubes. It's common it's a common cause of secondary infertility. Then also, the man too might have what they call varicocele. Varicocele is a condition whereby there are dilated veins in the testis. This generates heat, and over time, over years, it kills the sperm cells. So maybe 5 years back, the sperm was normal, but as the year went by, all the sperm cells were dead due to varicocele. It's a common cause of secondary infertility. Or maybe the man, maybe the man or the woman had a cancer that was treated. So those drugs can shut down the reproductive organs. So most times, you normally screen them, so you collect them, do a test, and if they fit in for IVF, then we do IVF. Yes.
Somebody asked a question: how do you source for egg and sperm donors, and are there any legal implications?
Okay. Okay. The way it works is once the couple has agreed to use a donor, there are two ways. We have the known donor and the anonymous. Known to bring somebody, maybe they're to donate for them. Then we have the anonymous donor, which the clinic would search for. Now, most clinics have an agency that is the help for donors. Now, the way the egg donor, for example, so she must be between 20 to 29. They must medically fit. They are screened of all forms of diseases. Their blood pressure is checked. Their sugar level is checked. Screened for their genotype. Most times we stick to AA to avoid, giving birth to SS. Then we collect them, we screen them for asthma, diabetes, hypertension, epilepsy, and the rest. Then also, they're also being psychologically interviewed, check their mental status to ensure that they are psychologically stable. They're not, they don't have mental issues. Then also, most importantly, we check the ovarian reserve, because that's the reason why they are donating. If the lady does not have enough eggs in their ovary, there's no point donating. So it's actually a long process. It's not just easy to just say, I want to do an IVF the egg donor tomorrow and we start. No, it takes a long process. We also match. We try to make sure that the ladies of similar resemblance with the intended mother. So then after you've now found the perfect fit, those donors also sign some legal documents to make sure that they have no rights to and to understand that they are voluntarily donating their eggs, not that they are selling their eggs, they are voluntarily donating their eggs. So they sign documents and then we start the process. So the donors are also properly taken care of because they are doing a big thing. They are trying to make a couple happy. So we try to make them comfortable and we do the needful. Likewise, for a donor sperm, someone who donates sperm, they have to go for screenings. First of all, we have to know whether the sperm count is okay. They will now undergo screenings. Hypertension, diabetes, hepatitis, HIV, the list goes on. So once they are fit, they sign legal documents to ensure that they are voluntarily trying to help couples to achieve conception.
What is the success rate of donor eggs and donor sperm? What's the success rate?
Compared to normal IVF, whereby couples use their own gametes, it's higher. So I would say maybe 55% on average. 55% on average, because sometimes it also fails. It's not guaranteed. Because it could also be a womb issue. The womb might also have an issue. So sometimes the womb might be perfect, the egg might be perfect, the sperm might be perfect, and yet it still fails. Sometimes you don't even know the reason why it fails.
Wow.
That's IVF for now. The last conference that I attended last year, they are now going to a level whereby they can test a woman's womb to know if once she does IVF once, it will work.
Right.
They are still working on it. So maybe when that test comes out, it will be easy for a woman to just do that if I know her fit, whether she will get
just know
or not.
whether to go and adopt straight.
So yeah, so we are praying for that test to come up so that it will also help to improve the outcome of IVF. And all know that to go for IVF or surrogates immediately.
Yeah, I think that's the way to go, definitely.
Yes.
There's one last question. Why is Nigeria not conforming to single embryo transfer?
Well, single embryo transfer, it's in two ways. The advantage of a single embryo transfer is that it prevents pregnancy complications. It reduces the risks of miscarriages, the risks of preeclampsia, and the risks of all morbidity and mortality that pertains to a woman. But its advantage is also that it's some people say it reduces the chances of pregnancy. But let me give an example. If you most times, we transfer 3 embryos. The woman gets pregnant, she comes for a scan after a month, and we scan her, and we find just 1 baby there. So what happened to the other 2? They stop growing or what? So we can assume that, okay, as we are transferred 1, maybe it shouldn't have gotten pregnant. So some studies will say the more you transfer, the higher their chances. Yes. But especially abroad, in the UK, it's strict. It's either a single embryo transfer or 2 embryo transfers. They don't want to care whether there will be it will reduce or increase their chances. So, but for now in Nigeria, the maximum we do, like I said, is 3. And again, right. it all depends on the quality of the embryos on day 5. We have what they call we grade the embryos according to their appearance. We have the grade A, B, C, D. So if the embryos are all looking grade A, they're looking very beautiful, then we can always transfer 1 or 2. But if the grades are not looking too fantastic, we just end up transferring the whole 3. And I get pregnant. And when you do a scan, there's only 1 or 2. And sometimes the 3 will be there. Yeah. So I believe once we improve in our technology, because we definitely can't compare our own technology here to the Western world, as in, abroad. We are still improving. I believe the more we advance in technology, a time will come whereby we will do a single embryo transfer. And again, the reasons why they do single abroad is that they do what they call PGD. That's pre-implantation genetic diagnosis. The embryos are screened to know whether they are chromosomally normal. So if the embryos are all normal, then you can transfer 1 to the woman. But in Nigeria, doing PGD is expensive on its own. The average cost is 2.5 million. Wow. To 3 million. Apart from the money for IVF. So if you tell them it's too much money, so most times, okay, then pregnancy should have a high chance of getting pregnant. So most times they do a PGD before they do a single embryo transfer. Thank you. Yeah.
Thank you very much. Can you please help us go into the question and answer box? There's some questions there for you, but I would like that you please answer them offline so that I can call on the next speaker. Thank you very much, Mr.
Right. Thank you very much. Thank you very much.
Mr. Daramola, yes. I wasn't sure that I was getting your name right. I wanted to be sure. So thank you very much. And we're going to call you again because there are so many things to talk about and we're trying to rush it.
I understand.
And so please just expect our call again, and please avail yourself to us so that we
All
can
right.
help people. Thank you very much, sir. Have a
All right.
wonderful. But please stay and just listen to us as we carry on, and please
All
help
right.
us answer the questions
All right.
that people are asking you.
Can I
And
just say
Mrs.
one thing before?
Yes, please. Yes, please.
Okay, just to encourage everyone. Just remember that not everybody needs IVF. You know, all our paths are all different, but seek good advice. You know, so you get directed to the right paths. Thank you. Yeah.
Thank you very much, Mr. Daramola. That was very, very hopeful. Thank you. And please, guys, listen to him. I don't think we're, like he said, it's not everybody that needs it. So don't be too fearful. Go for your test. Check yourself. Make sure that there are other options before you go into it. It sounds really daunting as I'm listening to it. Like my whole body is cringing as I'm hearing some of the things that need to be done. But hey, I mean, at the end of the day, we know that there's success to for some people, and it's worth it at the end of the day. So thank you very much, Mr. Daramola. Mrs. Ebele Chuku, are you here with us?
Yeah, I'm here. Hello.
How are you doing?
I'm good. And you?
Very well, thank you. And let me just quickly read your bio. Ms. Ebele Chuku is the president of Fertility Nurses Association of Nigeria. She's also the CEO of Fertile Moms International Limited. We're happy to have you here, and we're talking about surrogacy.
Oh, I'm happy to be here as well. Thank you for having me.
Thank you very much. So let's just go straight into it. What is surrogacy?
Surrogacy is a process whereby someone helps another woman to carry pregnancy. Now, we have two types of surrogacy. We have traditional surrogacy, we have the gestational surrogacy. The traditional surrogacy is a type where the woman uses her egg, but the sperm from another man will be inseminated into her. And she gets pregnant, carries the pregnancy to term, delivers, and hands over the baby to the person she's carrying the pregnancy for. Now, the gestational surrogacy is the process whereby her eggs are not involved at all. So she has no biological link to the baby she's carrying. The egg from the person she's going to carry the pregnancy for and the sperm from the partner or the husband will be used in the process of IVF, just like Dr. Daramora has already enlightened us on IVF. And then the embryos this time will now be transferred into the gestational carrier. If you notice, I keep using the word gestational surrogacy, gestational carrier. That's to show you that she has no biological link to the baby that she's carrying. Now in Nigeria, well, both of them are practiced. In traditional setting, you may hear things like female husband, in a case where a woman got married, but she didn't have any baby, she went and married another woman to have a child for her husband. That could be used or referred to as traditional surrogacy. Now, I've already explained gestational surrogacy. So even in Nigeria here, gestational surrogacy is also being practiced.
So how popular is it in Nigeria? Because I'm hearing you say the traditional and the gestational surrogacy are available. How popular is it in Nigeria? And how open are people to it?
Gestational surrogacy, I would say, is becoming acceptable here in our country, Nigeria. Although, thanks to avenues like this, we keep enlightening people, we keep telling them, we keep educating them. Most people are actually not as open to gestational surrogacy as you would expect. You know, because of our traditional belief, because of our culture, because of our belief system, our religious inclination, and all whatnot. So it's just like adoption. People are not open. People are not embracing it. People are not encouraging other people to go into it. So for us, as an association, I'm talking about Fertility Nurses Association right now. This is one of the things that we do. We enlighten the public. We want to educate them, to make them to embrace opportunities or avenues that, would give them the hope to achieving parenthood.
What are some of the fears that these people have? What are some of the fears that they have shared in terms of surrogacy, either of the two kinds?
For the intended parents, now the intended parents, we are referring to the couple that have contracted a surrogate to help them carry pregnancy, or you can also call them commissioning parents. The fear most times, here I already mentioned the barriers, like the culture, the belief system, the value. You know how it is that when a woman is pregnant, she wants everybody to see her pregnant. She wants everybody to know that she carried the pregnancy herself. Sometimes if you open the social media these days, you see people posting pictures of them during pregnancy and then the different stages of pregnancy. So sometimes the intended mother or the intended parent, one of their fears is the fact that they feel like they have lost out, especially the woman. She feels like she has failed in her ability as a woman to carry pregnancy. That's for them. That's for the woman. Another thing is the fear you hear when I counsel some couples, you hear them say, oh, are you sure she's not going to carry my baby and run away? What are you going to do? How are you going to ensure that, she's available at all times? What are you going to do to make sure that she doesn't start sleeping with another person? These are the little fears that they express. Another thing is also the belief system, the religious inclination that we have here in Nigeria. Some religion, I'll use the word enthusiastic religious people. Let me just use that word. Sometimes they don't believe that it's right. They don't believe it's okay to get another person to carry your pregnancy for you. Sometimes if you ask them, they just don't have any reason. They just tell you, oh, my religion, oh, no, I don't think it's right. Oh, I think it's a sin, However, if, let me just chip in this. For some of us who are Christians, there is a mention, if you go as far back as Genesis, you will see the first time surrogacy was used. That was in the case of Abraham and Sarah, and then that led to the birth of Ishmael, where Sarah gave Abraham her maid servant to impregnate so that they can have a child. That's in the case of traditional surrogacy this time. Now, I don't think it's actually something that you would say is a sin. Personally, that's my belief. But you still see some people telling you, oh, it's a sin. I don't think I want to do that. Oh, no, my religion. Oh, da. Oh, how will people see me? How will people look at me? These are just some of the things that, takes them back, makes them to withdraw. And of course, even the society is not helping.
Yeah.
People do not mind their business. That's how I would say, go and buy baby. Are you sure this did not happen? Are you sure that did not happen? I mean, people don't mind their business. To use that word, people do not mind their business in Nigeria. They keep focusing into another person's issue. And that's why you see those women, they don't feel comfortable. They don't feel confident that they are going to do. And when I talk to clients, when I'm counseling them, I tell them, you don't owe anybody any explanation. It is your life. You did not buy baby. You did not steal baby. So it is your life. The highest you can do is to explain to them, oh, this is what I did. But of course, you will agree with me again. Another problem is that people don't even talk about it. They don't want to talk about it. They don't want to tell another person. Like Mr. Praise said, somebody gave a testimony, oh, God bless me. They don't tell you how they went about it because your testimony could help another person.
Absolutely.
So we are very silent on anything that has to do with assisted reproduction technology. That is the reality we are in. The stigma associated with that makes a lot of couples to be withdrawn, especially women, because they are the ones that, everybody wants to see carry pregnancy. Now,
yeah.
for the surrogate, some surrogates are also have expressed this fear. I've had a couple of them express the fear. People just want to know where I am. So some of them actually don't want to stay in their environment or anywhere close to their environment. And of course, one of the things I do when I'm counseling surrogates is to ask about the support system. I want to be sure that your family knows that you're doing this. I want to be sure that you have a support system. So you don't just express the desire you want to serve as a surrogate mother, gestational carrier, by the way, that's what I'm talking about. And then you just get enrolled into the process. It is also a process, it's a journey, just like Dr. Daramara has already told us. IVF is a journey. Gestational surrogacy is a journey. You will go through the screening, but part of my own assessment is to go into your home. We do home assessment. We want to be sure that you have a support system. We want to be sure that people around you know what you're doing. If you're married, your husband must know what you're doing. If you're single, your mom, your parents, your dad, whoever, your friend or your sibling, somebody must know what you're doing, just to be sure that you have a support system. And then if you don't want to stay in your environment, which in most cases is a situation, you could be moved from where you are to another place. But some of them also want to be sure that they are protected. By this, I mean, they are scared about death. Of course, if you're counseling them, you have to make them know that death is one of the risks.
Yes.
You can't rule it out. We are in a country, we are in an environment where we have a very high maternal mortality rate.
Yes.
So
yes.
they are scared. They are afraid. They want to be sure that everything will go well. And part of the things that I also do is to make sure that the IVF clinic, of course, I will give it to most IVF clinics in Nigeria. For now, we are trying, given our own technology, given our own knowledge and expertise. I want to be sure that the IVF clinic is also a very good one and has a very good quality system in place. Another thing is we go into the hospital. If the intended parents say they want to use hospital A, we go into the hospital to be sure that the hospital also has a very good customer service, has a very good delivery process. In fact, that she's going to be safe throughout the process. Because it's not just about carrying pregnancy, her life, the gestational carrier's life is of utmost importance in this whole process. If she's not alive, there's no baby. If she's not alive, the whole process is wasted. So you need to be sure that she is also protected. And in some instances, I've gone into a hospital and I tell you, Mrs. B, this hospital, I'm afraid we can use them, and I will give you the reasons why we can use them. And then you have an option to give us another hospital, or we can also tell you, we've used this one, we've tested them, we know that they are good. Do you want us to use this? And if you say yes, then we'll go ahead. So it's also important that they are protected. That's the gestational carriers as well, because most of them are afraid. They want to be sure that they're not going to lose their life, even though they know.
How do you find these women? How do you find the surrogate, but the gestational mothers or carriers?
Okay, we have a lot of them who who call on the phone. Some are also introduced by a friend or someone who has already gone through the process and understands what the process is all about. And maybe in the process of discussing with our friends and they indicate interest, they call and then we invite them for counseling. We talk, we do the psychological assessment, the physical assessment, and all the necessary things that needs to be done. Then if the investigation comes out, the medical screening comes out okay, the psychological assessment comes out okay, the case is out okay. But if she fails in any one of this, we'll keep her on hold until everything is okay. We turn down a lot of them that come, they want to do surrogacy. I must say that most times, most of them, the first thing that interests them, oh, she said while she was doing it, they were giving her money for feeding, they were doing, oh, that's enough money now, I'll just be sitting down. Maybe my own is just to carry pregnancy, and they'll be giving me money. No. In the process of counseling, you are made to understand that this is not a child's play. It's not an easy thing to carry pregnancy for another person. It's not even an easy thing to carry pregnancy. And so all the risks, all the complications, everything that is involved in the process will be explained to you. And then you go back home, take a decision, and call us back.
So now when they're inseminated, did I get the word right?
When they are
when the embryo is put in them, if it's coming from whatever process, so when they've gone through the IVF process,
yeah,
do they go back
the
home?
embryo transfer?
Yes. Do they go back home, or are they put in a house where they live and they're being looked after, or do they go back to their normal everyday life and just carry on with life with the pregnancy?
Oh, after the embryo transfer, just like somebody who is also going through IVF on her own, carrying the pregnancy, her own embryos, they go back home. However, they are given instructions. Apart from the instructions that the clinic will give them, we also call and we follow up with those instructions just to make sure that they are keeping to those instructions. And then we also go to visit them during those 2 weeks wait. While we're waiting for pregnancy test. So yes, they go back home. We don't keep them somewhere. Remember I said we do home assessment to be sure that they have a family support
System, yes.
Yes, so they still go back and keep living their normal life. You don't make them feel like they are carrying an egg that is going to break anytime soon. No, because that's also going to make them feel scared or afraid. And then when it does not work, they'll start thinking, oh, is it me that did something? Did I do something wrong? And all that. You just make them, counsel them, make them understand the processes, and let them live their normal life. When it's time to move, you move them. If there's any need.
Okay. Yes, finish, please.
I was going to say, if there's any need to move them before the time that we usually move, during the home assessment, that would have been discovered. So we move earlier if need be.
Okay. And what are the benefits? What are the possible benefits of surrogacy and possible challenges as well? I mean, I know we mentioned death could happen. I want to believe that some of the challenges are the girl, the gestational carrier could decide that she wants to keep her child, because I've seen movies and I've heard one or two situations where they said, you know what, I've created a bond with this child, especially when it's the traditional kind, and I don't want to give up my child anymore. I want to keep my child. I want to believe that those are some of the challenges. Am I correct?
Okay, so as I said, for traditional surrogacy, IVFs are not actually, IVF clinics or fertility clinics are actually not involved in that. That could happen unknown to anyone, or even sometimes even when it's known. Well, it's for them to decide how they want to sort that out. Maybe they bring in a traditional ruler or whatever means they want to use, because there's usually no legal documentation. But in gestational surrogacy, I must also say that the only reason why a gestational carrier, would want to keep a child is if her eggs were used. But remember I said, the reason why it is called gestational carrier is the fact that she does not have any biological link to that baby. Her egg is not involved. The sperm of her husband or partner is not involved. So she has no link. She's more like a host. That's why it's a carrier. She's not like the person just carrying the pregnancy. Well, in traditional surrogacy, that could happen because she's the biological mother. She's the one that her eggs were used. So even if you go to court, she will still because her eggs were used. And like I said, there are main documentation, but in case they got documentation. So you're not just going into it, you have to understand what you're going into. And you have to understand that you're signing a legal document that says you're going to relinquish the baby after birth. Now, in the legal contract, one of the things that the lawyers will use, make sure, is to include that clause. There's a particular page that will make you understand that you're going to release this baby. As other than that, we also have what we call parental order. So you're going to sign either pre-birth or post-birth parental order that you are relinquishing this child and you understand what you're doing. So if it's a pre-birth, you're going to sign it before the delivery. If it's a post-birth, you're going to sign it after delivery. Depending on what obtains, how soon you recover. But most times, 6 weeks after delivery, you both sign a pre-birth order. I mean, a post-birth order, sorry. So talking about taking the child in gestational surrogacy, no, that doesn't happen.
Because of course there's no connection, like I've learned. You know, I didn't know that there was a difference in the surrogacy plan, you know. I really do hope that people start to expand their minds enough to see that this is also an option to being a parent, you know, and there's nothing really to be ashamed of. If it's something you can't, we all can't do everything, you know, and for those out there, I mean, it's not, don't see yourself, I guess, as somebody who's useless or terrible, or I mean, don't allow people make you feel that way because you're not able to birth a child. Not everybody is going to be able to birth a child. Not everybody is going to be able to get married. Not everybody is going to, you know, so we're not all going to be able to do everything. But if it's a desire you have and it's not something you can do, then there are options. And Ebele has just shared another option with us. So we will call you back, Mrs. Ebele, because we haven't really entered this matter very well, you know. I guess today was just for us to talk about it and then see how much we need to delve into it. And there's a lot more to delve into because there's, I mean, this is like a, let's just touch the top surface, you know, and then we can go deeper later. So thank you so much for your time. Thank you for all the clarity that you have given me. And I'm sure that you have given so many people here, and the hope also that you have given people that it's possible. And it's, I mean, it comes with its own challenges, but it comes with its own benefits as well. And at the end of the day, you still get to carry a child, whether you birth the child or not, doesn't really matter. You still get to call the child yours. Thank you very much. And if possible, there's some questions in the Q&A box. Can you please help us answer it privately whilst we carry on with the conversation? Thank you so much, ma'am. Thank you very much. It was nice having you.
My pleasure.
Can we please have Mrs. Etang Abang? Are you?
Hello.
Hello, ma. How are you?
How are you? Yes.
Your beautiful smile. Thank you. That smile just gave me some energy.
Wow.
Thank you.
Well done for the work so far.
Thank you very much, ma'am. Thank you.
Oh, okay.
And so we're going to now crown everything up with you just sharing hope and teaching us how to not put on too much pressure on ourselves concerning this childbirth. I wrote down something here, and my question, or it wasn't even a question. I think it was more from saying that in Nigeria, I know there's a progression. You finish school, marry, have kids, and there's too much pressure on us as a society. How can we promote a change on the pressure we give ourselves regarding having our own personal babies?
Wow, that's a tall order of questions, but I'll try to navigate it.
Thank you,
in
ma'am.
Nigeria, no matter your economic and financial status, culture has put in the perspective of the mind of young couples that after the wedding, first month passes, second month, third month, what do they expect? They want to see a bulging stomach to show that the marriage is fruitful. I choose my words carefully. The marriage is fruitful. However, when the marriage is not fruitful, who is looked upon as the likely cause of unfruitfulness? is the woman.
Yes.
And she gets to be called barren. Oh, maybe the man has married a barren woman. Barrenness, if we refer back to the Bible,
Yeah.
as Exodus 23:26 tells us, it talks about barren, just defining you in every aspect of life, not just focus in, the fruit of the womb, that you are not fruitful. But it's been put as a powerful stigma in the life of young couples, expecting to progress into this fruitful life.
Yeah.
And yet they are not portraying it. So it becomes an insult and a shame. That is when the pressure starts. Just to pose it to England, UK and abroad, when young couple marry, the first thing they want to look at is, let's have a decent home, a good job,
Yeah.
a sure income. And let's understand ourselves first, that if we do get on to raise an offspring, we will give that offspring a good chance.
Yeah.
But in Nigeria, it's the other way around. With all due respect to struggling young couples, whether they are still living with their parents or they've managed to move into a self-contained apartment, the first story in their life to show that we have arrived is to have a baby. Whether they are eating well, whether they have a good job, or whether they are even well placed in career prospects. The pressure starts. And like the doctor has defined, after 6 months, nothing happens. Within 1 year, ideally, the quest to start checking, are we okay or are we not okay? That's why some clinics, like if I may state my clinic, the Bridge Clinic, we say, check your fertility status after 1 year. By creating awareness through this your platform, we are creating that awareness to say, check your fertility status. Don't go on the blame part first, because that increases the pressure on the woman. Because the society, first of all, gives the man that respect, that authority, and a clean slate in the myth that he may not be the one that is having an infertility challenge. As long as he's ejaculating, firing blanks that has not been confirmed whether there is sperm inside it, he is okay. The woman is not okay. And because the society has already put that burden on the woman feels adjudged. She feels maybe I've not brought value into this marriage. What does she do? Like the doctor said, and like Mr. Praise has said, the woman starts going through the journey of investigation, the journey of finding out. But it takes two to tango.
Absolutely.
If she were to say, oh boy, let's go and check out ourselves. He said, I've been bringing out things every time we meet, So why do you say something is wrong with me? It's you that should be carrying something that is not carrying. So she doesn't even have a voice. She's been silenced. And her pressure is building up. And this is a container, if I may say, that should be in a very relaxed mood to be receptive to pregnancy. But now she's working on that tense environment. Cortisol level is rising, affecting her estrogen performance, and her hormonal balance is already affected. So like in the clinic, we say, come and check your status is for both man and woman. When we start the journey that way, the role that I have as a counselor is support this couple, no matter what the result is. They say one can kill a giant, but two can kill 10,000 giants. So support them and let them work together as early as they want to make babies. So the hope today, from what we have heard, nobody gives money for IVF. Nobody gives money for any trouble anywhere. But you need to be prepared if you need to venture into those areas. And to make matters worse, because IVF is very expensive, they start the medical journey with their physician, not a gynecologist, not a fertility specialist. So the journey is extended. Right. Rather than go to a motor park that should take you to Abuja, you start from a place you are just saying, maybe if I take Okada to this point, it might be cheaper, whereas you're extending the journey. So by the time they go through the physician now says, you need to see a gynae. They have already expended money. Yes. From a gynae to a specialist, they have expended money. And then the specialist now says, after so many years of trial and error, he means well. He wants to help them, save them from IVF. They have wasted 1 year, 2 years, 3 years, 4 years, 5 years. And at this time, the woman's age is progressing. Absolutely. The man is still younger. He can reboot his sperm after 3 months. But the woman, as far as she is menstruating and ovulating, she's depleting her age. By the time she comes to the fertility clinic, a lot has left her. And she comes almost depleted. Depleted by her hormonal products through stress, depleted by her body aging, and probably depleted by, financial stress. And to make it worse, at this point in time, maybe the husband is very busy at work, so he's not working pari passu with her. She's almost a loner. And you see what is happening to the woman? The journey becomes longer. What counseling can you give to such a woman that can change her perspective? She's ready to do anything now to show that she is productive. But there are other things that are affecting her that she has come into the treatment. The doctor rightly puts, the process is not an easy process. Yeah. But first, she has to be detoxed of this emotional baggage that she's coming with. Yeah. And it's not only from her, it's from the husband that now sees the IVF bill and says, what? Never. What people just get naturally? Where did I get you from? So it involves a lot of counseling, a lot of emotional preparation to say, no matter where you have come from, there is a starting point. And as you start, there will be an end to the journey. This is what I will advise people to say. Walk straight into a fertility clinic after 1 year of trying with regular, consistent, unprotected intercourse. Come straight and do your fertility status check. That will determine, like the doctor talked about, the AMH check for the woman, the semen analysis for the man, and that already gives us a baseline to say, this is where you are and you can start. Right.
So boycott all the other different people, the gynecologist, the physician,
walk straight.
Go straight to the fertility clinic, know your status, and know exactly what you need to do.
Yes. Right. And some of them, even before, when they get to the clinic, it's not just some of them know that they have done the other journey that has delayed them. They will always sometimes say, I need to see a counselor. And the counselor will ask, where have you been? And makes the woman's journey to feel a little bit better. Her steps are a little bit lighter, that there is counseling support to enable her to go through this journey. So she comes in and makes the inquiry, and then we guide her through the process, introducing her gradually into this system of having to see the doctor to get to the point of taking injections, coming in for scans, follow-up treatments. It now makes it a lot easier for her to coast along. So my hope today for a lot of men and women there is infertility is real. Real on the sense that it's not a spiritual attack. Yeah. Even if it's a spiritual attack, take actions into your hands today. Don't delay. We are now seeing women that are in their early 30s because of this stress and progressive tension within them. They are having their ovarian depleted faster than normal. the doctor can confirm that. But if you have started when you are young, those stress would have not accumulated to become toxin within your hormonal system. So start early, plan early, and take the right step.
Woo! Thank you, Mrs. Mrs. Etang Abang. First of all, I want to just quickly read out your bio because I didn't in the beginning. Mrs. Etang Abang is a counselor with over 30 years working experience in the UK and Nigeria. She holds a Master's of Law degree from the University of London, a Bachelor of Law degree from the University of Lagos, and a certified professional negotiator. Mrs. Etang Abang is a fellow of West African College of Nursing, a certified health visitor and public health nurse. She is currently the head of counseling at the Bridge Clinic in Lagos. I personally think that people should rush down to you. Anybody really at this point who is thinking about going through this process and has not, like Dr. Daramola said, after 1 year, and you've also reiterated, after 1 year of active sex without protection, and it doesn't happen, then just come straight to the fertility clinic. I mean, it's even now, I even know what to say to people who mention this thing casually around me. I'll just say to them, go to Bridge Clinic and go and ask for Mrs. Etang, Mrs. Abang. Or
Yeah,
just
welcome.
go to a fertility clinic and go and know your status immediately and start from there, rather than spending time, money, emotions, and all that pressure on other places, and they've not been able to prefer any solution. And so, guys, we've heard today, and Mrs. Abang, we're going to call you again. Like I said earlier on, this was like a let's test it out and see how much information we can get. And we're going to call you again because there's a lot more. I mean, just the little nuggets that you dropped, or the diamonds that you dropped, for me has been so phenomenal. So I can't imagine what will happen when I now spend a whole hour with you and you're able to truly, truly, truly give people hope and show them, what is possible. Personally, I've learned a lot today, and I really am grateful for your patience. I'm really grateful for your temperament, and your beautiful smile. Thank you very much for your time, and we'll be in touch again, like I said. And so when we come knocking, please open your doors to us.
You are welcome. We are always there to serve the public and ensure that they become fruitful without tension.
Thank you very much, Ma. Thank you very much. And I hope guys out there, we've learned a thing or two about IVF, about surrogacy, about adoption, and just about the fertility cycle and circle and counseling. I believe that we should all see a counselor. I think we're all going through all kinds of different issues, and having support, and somebody that can just show us how to find that hope, is really important, because it's the hope that keeps us going. So guys, please cut out the steps and go straight to the fertility clinic and know your status, and let's take it from there, so that we reduce the stress, we reduce the money that we're paying, and we reduce the tension that we go through. And men, please realize women are not the only ones that are part of reproduction. You need a man and a woman. You need two to tango. So it's not a woman problem, it's our problem. And so how do we face it together? And it's not by saying, oh, you go, I'll meet you later. No, it's about how are we going to do this? And make sure that you keep to your word and give your wife as much support as she needs. Because as it is, she's going through quite a lot of hormonal changes, hormonal imbalances, the pain, the injection. And so a little support from you really helps. And women also support your other women. It's sad that we're the ones also sometimes that hammer on the woman. Say you are the barren one, you are useless, you are this, you are a witch, you are a demon, we're the ones that call ourselves that. And so you hear, don't worry, I'll bring another woman that will have this for my child, So let's also stop beating ourselves and stop pointing fingers at ourselves and stop being mean and wicked to ourselves. So the men will do theirs, but women, please, it's also a plea that we should first mind our business. Let's start from there. mind your business. Let other people face their own front and mind their business. And stop being monitoring spirit into whether somebody's stomach is growing or not growing, or asking people, when do you want to start having children? A family for me is a man and a woman. Once they come together, that's a full family. Whether you decide to have children and whether you decide to have cats or you decide to have dogs, for me, a family is a man and a woman deciding to come together. And let's leave it at that and stop asking irrelevant and wicked and mean and derogatory questions. That would be my plea from my side. And so we've got Lanre, who is a dear friend of ours, dear friend of the house, who has also been through IVF a couple of times, and she's here looking all pretty in her glasses. Lanre, I know that you are fasting, but you're here today, you know, and so, I mean, you don't even have a choice. You might think you had a choice. Yeah, you didn't have a choice. But can you, please, can you share your story with some people and give them air to breathe and give them hope to leave this seminar today with hope, knowing that if you could do it, they can do it too.
Okay, so much, John. It's so good to be here. It's been so, interesting listening to everyone, Mrs. A, Billy, the doctors in-house as well. I think it's been a beautiful, session tonight. Especially when, the doctor did confirm that it's a journey. And for me, I always say it's like you going to Abuja and, you don't know the gratitude or you don't know the intensity of, the turbulence you would meet along the way. So, that turbulence it determines your level of, your faith, how committed you are on the journey. He did also mention it's a goal. It's like a target. Give yourself a target and knowing this is having the end in mind. This is where I'm going. So for me, and I'm even happy about this session. Also, in fact, that all the things I'm knowing now, if you knew them way back then, I'm sure I would have gotten on the journey much earlier than I did. I did 6 years into my marriage, and I went through about 7 cycles. Of course, I know some people would say, "Oh, yeah, we've had more field cycles like that." Me, why I love to share my story is because in that, the 7 cycles I was able to touch on, the different experiences, different, the different trials people have on this. So, so the first one was me, just as the doctor said, when you get in, the first thinking, oh yes, everything is going to be all smooth and all. Yeah, so the first one didn't work, but after a while, I was actually prepared anyway. The second work, then we had a miscarriage at about 5 months, down the line, we had like, yes, miscarriage and like stillbirth actually. And even along that, I had the belly. So Ebele was, with me on that journey as well. And that's why I'm even happy seeing her all the time. Each time we have cause to speak on this fertility journey together. So, so the second one didn't work. We had the miscarriage apparently. So the third one, what happened the third one? So the third one, yeah, did work. So I had a baby girl on my third one. But what's important for me in that journey is every single time I had OHSS. OHSS, I think the doctor didn't mention it was, it's called the ovarian hyperstimulation, where, you get stimulated for the, eggs and all that. So I had OHSS and I was always in the hospital. If I managed, that can actually lead to, to death as well. And in the first time I had like 45 eggs gotten for me. And of course, I was also happy to have actually shared to people also on the waiting list. So here's my journey on for the third child, who I had a baby girl. Then the fourth time as well, I started that beautiful journey again. And along the line, the doctor realized my body wasn't responding. So they had to cut the short and I had to start all over again, Wow. So on the fifth one as well, the day I was going to go for my egg collection, there was this horrible traffic on Third Mainland Bridge. I had to get off I got into an alternative VI for my egg collection. Getting there, they said I'd ovulated, no eggs to be collected. I had to start the journey all over again. So wow. the sixth one didn't work, but luckily for me, there was something, then at that point, we could start freezing our eggs, so I opted for that. And that was what saved me for the 7th, So eventually I had to use my frozen embryo to get, boy, at it all. So for me, basically, I just as Mrs. A had said, fertility check is important, having the goal, the end is very important. I tell people on the journey, having someone like Mrs. A, where it wasn't there at that point in time, like a counselor to speak to put you through, all the culture, to navigate the cultural, barriers or challenges that does exist. In terms of stigmatization, I would say to a reasonable extent, it's actually reduced. I think I would say that, because there's more awareness now. We're beginning to embrace it. Yeah, maybe the area of surrogates, of adoption, even adoption to a reasonable extent, people are accepting it. Yeah, maybe where your challenge is the fact that when you need donor egg, but not accepting to that reality, is somewhere we're trying to navigate through as well. Then now is also about sex selection. Now people are more conscious. They want a male, child, and having to go through process and know it come. Maybe you still need to use a donor egg to achieve that, something. I'm sure Mrs. A, she's in a very good position, because I do a lot with her. We do, referral of, clients to her, and I think she's really doing a good job in this industry, really. So so for me, that's been the journey. I've got people who've done it for 13 times, and they only had just one success. So basically, it's about having the goal in mind, getting focused, prepared. You be prepared financially. It's not cheap. It's not cheap. So you need to be prepared financially, just as she said, and be faithful. That's just about prayers. Doctor did say it as well. Yeah, it's a scientific process, but trust me, at the end, it's a waiting period of the 2 weeks that he said, you give it a go. It's prayer. Yes, it is. It is.
Wow.
That's it for me, Tala.
I hail you, my sister. 7 times. I mean, it just one is mind-boggling to me, and 7 times, and this was through your health, through all the possibilities of all the things going wrong, but then your mindset was set on it, and you were sure that it was going to happen. And so I think for me, what I'll pick from that story, aside from the fact that you had your beautiful babies from that process, you were also ready. You were ready financially, you were ready emotionally, and for me, those two, and maybe also physically as well, for the process. And nothing, you didn't allow anything stop you. So for those out there who listen to Lanre, it's a journey.
It is a journey. And also, along it all, just as Mrs. A said, your career is still going. You still need to put yourself together. Do you understand? Not for the work. We need to, just as Pray said, we need to be appreciated at every single point in time. We need to.
Yeah, I think men need to wake up every morning and kind of kiss the ground, women walk on, to be honest. I think they need to like have rose petals that they used to wash our feet every day based on the things that we go through just to be a woman, and on this planet Earth. It's huge, and so it's the pleas for men out there to please be a bit more considerate of your wives. Be considerate of them, especially when they have extra challenges. They need your support to be able to achieve what they need to achieve. If Lanre's husband also didn't give her the support that she needed, she probably won't be here smiling and looking all pretty. Maybe, God forbid, something would have happened to her along the way. But today she's here, she's able to give her testimonies and tell people that I can do it, and so can you. But it's not a I, it's a we. And so let's give the support that we need to give to our wives, so that they're able to be relaxed and there's an enabling environment for them to thrive. And then they're able to do what they need to do. I think that's my own end notes for today. Thank you all the participants. Thank you, Lanre, so much for taking out of your time to be here. Thank you, Dr. Daramola. Thank you, Mr. Lanre. Sorry, Lanre. Thank you, Mrs. Ebele Chuku Ijoma. Thank you, Mrs. Etang Abang. Thank you, Mrs. Olaore, for touching all the sensitive places that people will not normally touch, but you touch them and you shed light on them. And we're going to call you back again. So when we knock your door, please open it, because this thing, we need to create more awareness about IVF. We need to create more awareness about adopting. We need to create more awareness about surrogacy. We need to create more awareness so people start to, you know, the pressure starts to reduce, you know, and we're able to relax and have a good time and have a good life without all those extra pressures and that we face. Thank you all for joining us and spending 2 hours with us today. I think it's actually a little bit over 2 hours.
Thank you.
We do not take your presence for granted, and so we're grateful for honoring us and all the people who joined in on the call. Thank you. I hope really that the first thing I asked was, what's the one thing that you would hear today that will make you leave here knowing that, or feeling like it was worth it? I hope you got that one thing. I really do. And I hope that the next time we call you again, you are here. And I hope all your questions were answered. If they weren't, please send us messages so that we can still answer your questions and be able to give you some kind of information that you need. I know that the email addresses of all our speakers were put up on the chat. Please look at them so that you can send in emails and start your process. Like Dr. A said, Mrs. A said, cancel all the steps, go straight and know your fertility, go and know your status immediately and start it from there, you know. And so maybe it will be a tad bit cheaper than it normally would have if you had started from the bottom. Thank you all for being here. My name once again is Adiola Kingsley James, and I'm honored to have served you. Thank you. Yeah, if you want to say anything before we round off. PF, do you want to say anything before we round up?
No. Everyone, thank you, everyone. God bless you. We love and we celebrate you. Thanks for coming.
Thank you.
We hope to see you some other day. At least we have started the conversation. Let's take it around.
Yes.
And let's begin to educate people, especially the religious spaces, to know that these are options that can help God's people, you know, get their blessing.
And give thanksgiving.
I even think that people who go to IVF need special Thanksgiving now.
Yeah.
And there is no more hiding to say, you know, they need to do, because that process is going through the valley of the shadow of death. Oh. God bless you all.
Thank you. Women, you are trying. You're really, really trying. And I'm very proud of all of you. And I hope you're proud of yourselves too. Don't let anybody stop you. Don't let anybody bring you down. Don't let anybody make you feel less than you are. You're enough.
And don't give up.
You're phenomenal. And please never, ever give up. Never, ever give up. Keep striving. Thank you. And have a wonderful day.
Thank you.
Thank you.